Want to score over 1,000 in your HESI Exit PN exam? Then let's get started. Today we'll cover 100 questions to help you prepare and pass your HESI Exit PN exam. Question 1. A client is receiving a continuous tube feeding through a gastronomy tube. Which finding indicates that the client may have an infection? Decreased bowel sounds, diarrhea, absent gag reflex, decreased blood pressure. Pause the video and select your answer. If you chose option B, you are correct. Diarrhea. Diarrhea can indicate an infection in a client receiving tube feeding. You can pause the video and go through the incorrect options. Question 2. A nurse is caring for a client with pneumonia. What intervention is the priority? Administering prescribed antibiotics, encouraging deep breathing and coughing exercises, providing supplemental oxygen, assisting with chest physiotherapy. Pause the video and select your answer. If you chose option A, you are correct. Administering prescribed antibiotics. Administering prescribed antibiotics is the priority in treating pneumonia as it targets the underlying infection. Question 3. A client with diabetes mellitus reports blurred vision. Which action should a nurse take first? Administering insulin, assessing blood glucose levels, providing eye drops, referring the client to an ophthalmologist. Pause the video and select your answer. If you chose option B, you are correct. Assess blood glucose levels. Assessing blood glucose levels is the priority when a client with diabetes reports blurred vision, as it can indicate hyperglycemia. Question 4. A nurse is caring for a client with heart failure. Which assessment finding indicates fluid overload, decreased urine output, hypotension, crackles in the lungs, bradycardia? Pause the video and select your answer. If you chose option C, you are correct. Crackles in the lungs. Crackles in the lungs are indicative of fluid overload in a client with heart failure due to pulmonary congestion. Question 5. A client is receiving heparin therapy. Which laboratory value should a nurse monitor closely? PT, APTT, INR, platelet count. Pause the video and select your answer. If you chose option B, you are correct. APTT, activated partial thromboplastin time. When a client is receiving heparin therapy, the nurse should monitor the activated partial thromboplastin time closely to assess the effectiveness and safety of the therapy. Question 6. A client is experiencing an acute asthma attack. Which medication should a nurse administer first? Ventolin, Singular, Flovent, Atrovent. Pause the video and select your answer. If you chose option A, you are correct. Albuterol or Ventolin. Albuterol is a short-acting beta agonist bronchodilator and is the first-line medication for relieving acute asthma symptoms by opening the airways. Question 7. A nurse is assessing a client with appendicitis. Which finding is a classic symptom of appendicitis? Rebound tenderness in the right lower quadrant, left lower quadrant pain, rigid abdomen, hypoactive bowel sounds. Pause the video and select your answer. If you chose option A, you are correct. Rebound tenderness in the right lower quadrant. Rebound tenderness in the right lower quadrant is a classic symptom of appendicitis and is indicative of peritoneal irritation. Question 8. A client with chronic kidney disease is prescribed a phosphate binder. Which medication is commonly used for this purpose? Lasix, Renagel, Zestril, Aldactone. Pause the video and select your answer. If you chose option B, you are correct. Sevelamer. Sevelamer is a phosphate binder commonly used in clients with chronic kidney disease to prevent hyperphosphatemia by binding dietary phosphate in the GI tract. Question 9. A nurse is caring for a client with hyperkalemia. Which intervention is appropriate? Administering calcium gluconate, encouraging a diet high in potassium, increasing IV fluid intake, administering sodium bicarbonate. Pause the video and select your answer. If you chose option A, you are correct. Administering calcium gluconate. Administering calcium gluconate is appropriate for treating hyperkalemia as it stabilizes the cardiac membrane. Question 10. A client with chronic obstructive pulmonary disease is prescribed oxygen therapy. Which assessment finding indicates a need for adjustment in oxygen therapy? Oxygen saturation of 88%, respiratory rate of 24 breaths per minute, pink, moist mucous membranes, decreased chest excursion. Pause the video and select your answer. If you chose option A, you are correct. Oxygen saturation of 88%. Oxygen saturation of 88% indicates hypoxemia and may require adjustment in oxygen therapy to improve oxygenation. Question 11. A client is admitted with suspected pancreatitis. Which dietary restriction is appropriate for this client? Low fat diet, high protein diet, high fiber diet, low carbohydrate diet. Pause the video and select your answer. If you chose option A, you are correct. Low fat diet. A low fat diet is appropriate for a client with pancreatitis to reduce the workload of the pancreas and minimize exacerbation of symptoms. Question 12. A nurse is caring for a client with a suspected peptic ulcer. Which medication should a nurse expect to administer? Prilosec, Reglan, Pepsid, Carafate. Pause the video and select your answer. If you chose option C, you are correct. Famotidine, Pepsid. Famotidine is a histamine 2 receptor antagonist commonly used to reduce gastric acid secretion and promote healing of peptic ulcers. Question 13. A client is receiving chemotherapy and reports fatigue. Which nursing intervention is most appropriate? Encouraging frequent naps during the day, administering a stimulant medication, recommending high intensity exercise, limiting fluid intake. Pause the video and select your answer. If you chose option A, you are correct, encouraging frequent naps during the day. Encouraging frequent naps during the day helps manage fatigue in clients receiving chemotherapy by allowing for adequate rest and energy conservation. Question 14. A nurse is assessing a client with rheumatoid arthritis. Which finding requires immediate intervention? Bilateral joint swelling and tenderness, morning stiffness lasting more than 1 hour, presence of rheumatoid nodules, difficulty swallowing. Pause the video and select your answer. If you chose option D, you are correct. Difficulty swallowing. Difficulty swallowing could indicate involvement of the cervical spine and requires immediate intervention to prevent complications such as airway obstruction. Question 15. A client is prescribed warfarin therapy. Which laboratory test should the nurse monitor to assess the effectiveness of the medication? PT, APTT, INR, platelet count. Pause the video and select your answer. If you chose option C, you are correct. International Normalized Ratio, INR. The INR is used to monitor the effectiveness and safety of warfarin therapy by assessing the clotting ability of the blood. Question 16. A client with diabetes mellitus is prescribed metformin. Which instruction should a nurse provide to the client? Take the medication on an empty stomach. Avoid alcohol while taking this medication. Increase your intake of foods high in sugar. Stop taking the medication if you experience nausea. Pause the video and select your answer. If you chose option B, you are correct. Avoid alcohol while taking this medication. Alcohol can potentiate the risk of lactic acidosis when taken with metformin, so clients should be advised to avoid alcohol while on this medication. Question 17. A nurse is caring for a client with a UTI. Which intervention is appropriate to promote urinary tract health? Encouraging frequent caffeine consumption, recommending cranberry juice intake, limiting fluid intake, administering prophylactic antibiotics. Pause the video and select your answer. If you chose option B, you are correct, recommending cranberry juice intake. Cranberry juice contains compounds that may help prevent UTIs by preventing bacteria from adhering to the urinary tract wall. Question 18. A client with chronic heart failure is prescribed digoxin. Which assessment finding indicates a potential digoxin toxicity? Bradycardia, hypertension, hypokalemia, confusion. Pause the video and select your answer. If you chose option D, you are correct. Confusion. Confusion is a manifestation of digoxin toxicity that requires immediate attention. Question 19. A nurse is caring for a client with a history of seizure. Which medication should a nurse administer during a seizure to terminate the seizure activity? Valium, Dilantin, Keppra, Ativan. Pause the video and select your answer. If you chose option A, you are correct. Valium or diazepam. Diazepam is a benzodiazepine used to terminate seizure activity during an acute seizure episode. Question 20. A client with cirrhosis is at risk for developing hepatic encephalopathy. Which dietary restriction should a nurse implement for this client? Low protein diet, high fat diet, high carbohydrate diet, low sodium diet. Pause the video and select your answer. If you chose option A, you are correct. Low protein diet. A low protein diet is recommended for clients with cirrhosis to minimize the risk of hepatic encephalopathy by reducing the production of ammonia in the GI tract. Question 21. A client is prescribed allopurinol for the management of gout. Which instruction should the nurse provide to the client? Increase your intake of foods high in purines. Limit your fluid intake while taking this medication. Report any signs of rash or itching to your healthcare provider. Stop taking the medication if you experience joint pain. Pause the video and select your answer. If you chose option C, you are correct. Report any signs of rash or itching to your healthcare provider. Allopurinol can cause severe skin reactions, including Stevens-Johnson syndrome, so clients should be instructed to report any signs of rash or itching to their healthcare provider immediately. Question 22. A client is diagnosed with hypothyroidism and is prescribed levothyroxine. Which instruction should a nurse provide to the client regarding medication administration? Take the medication with food. Take the medication at bedtime. Take the medication on an empty stomach. Take the medication with calcium supplements. Pause the video and select your answer. If you chose option C, you are correct. Take the medication on an empty stomach. Levothyroxine should be taken on an empty stomach to ensure optimal absorption. Question 23. A client is receiving IV morphine sulfate for pain management. Which assessment finding indicates a potential adverse effect of the medication? Bradycardia, hypotension, increased respiratory rate, dilated pupils. Pause the video and select your answer. If you chose option B, you are correct. Hypotension. Hypotension is a potential adverse effect of morphine sulfate due to its vasodilatory effects. Question 24. A nurse is caring for a client with COPD who is experiencing dyspnea. Which intervention is appropriate to promote effective breathing? Encouraging the use of a fan to provide airflow, instructing the client to breathe through pursed lips, administering oxygen via non-rebreather mask, restricting fluid intake to prevent pulmonary edema. Pause the video and select your answer. If you chose option B, you are correct, instructing the client to breathe through pursed lips. Breathing through pursed lips helps maintain positive airway pressure, prevents airway collapse, and promotes effective exhalation in clients with COPD experiencing dyspnea. Question 25. A client is receiving IV heparin therapy. Which laboratory test should a nurse monitor to assess the therapeutic effect of the medication? Platelet count, INR, APTT, PT. Pause the video and select your answer. If you chose option C, you are correct. Activated partial thromboplastin time. Activated partial thromboplastin time is monitored to assess the therapeutic effect of heparin therapy by evaluating the clotting time. Question 26. A client with pneumonia is prescribed Rosefin. Which assessment finding requires immediate intervention? Decreased white blood cell count, urinary frequency, dyspnea at rest, flushing and itching at the injection site. Pause the video and select your answer. If you chose option C, you are correct. Dyspnea at rest. Dyspnea at rest may indicate worsening respiratory status and requires immediate intervention, including assessment and possible initiation of oxygen therapy and further evaluation of respiratory function. Question 27. A client with chronic kidney disease is prescribed eoputin alpha. Which laboratory test should the nurse monitor to evaluate the effectiveness of the medication? Serum creatinine, blood urea nitrogen, hemoglobin level, urine specific gravity. Pause the video and select your answer. If you chose option C, you are correct. Hemoglobin level. Eoputin alpha stimulates red blood cell production, so the nurse should monitor the hemoglobin level to evaluate the effectiveness of the medication in treating anemia associated with chronic kidney disease. Question 28. A client with heart failure is prescribed spironolactone. Which laboratory value should the nurse monitor closely while the client is taking this medication? Sodium level, potassium level, calcium level, magnesium level. Pause the video and select your answer. If you chose option B, you are correct. Potassium level. Spironolactone is a potassium-sparing diuretic, so the nurse should monitor potassium levels closely due to the risk of hyperkalemia associated with its use. Question 29. A nurse is caring for a client with a traumatic brain injury. Which assessment finding indicates increased intracranial pressure, bradycardia, hypotension, unequal pupils, hyperthermia? Pause the video and select your answer. If you chose option C, you are correct. Unequal pupils. Unequal pupils can indicate increased intracranial pressure and may be a sign of a brain herniation. Question 30. A client with heart failure is prescribed furosemide. Which electrolyte imbalance should the nurse monitor closely while the client is taking this medication? Hyperkalemia, hypocalcemia, hypomagnesemia, hyponatremia. Pause the video and select your answer. If you chose option D, you are correct. Hyponatremia. Furosemide is a loop diuretic that can lead to the loss of sodium and water, increasing the risk of hyponatremia. Question 31. A client with a history of peptic ulcer disease is prescribed misoprostol. Which instruction should the nurse provide to the client? Take the medication on an empty stomach. Avoid taking aspirin while on this medication. Increase your intake of spicy foods. Stop the medication if you develop diarrhea. Pause the video and select your answer. If you chose option B, you are correct. Avoid taking aspirin while on this medication. Misoprostol is prescribed to protect the gastric mucosa from injury caused by nonsteroidal anti-inflammatory drugs like aspirin. Instructing the client to avoid taking aspirin while on misoprostol helps prevent potential gastric irritation. Question 32. A client with a history of asthma is prescribed a beclomethasone inhaler. Which instruction should a nurse include in the client's teaching? Rinse your mouth with water after each use. Use the inhaler only during asthma attacks. Take a deep breath and hold it for 10 seconds after inhaling. Store the inhaler in the bathroom cabinet. Pause the video and select your answer. If you chose option A, you are correct. Rinse your mouth with water after each use. Beclomethasone is an inhaled corticosteroid, and rinsing the mouth after each use helps prevent oral fungal infections, a common side effect of corticosteroid inhalers. Question 33. A nurse is caring for a client with a suspected pulmonary embolism. Which assessment finding requires immediate intervention? Decreased oxygen saturation, elevated temperature, dry, non-productive cough, decreased heart rate. Pause the video and select your answer. If you chose option A, you are correct. Decreased oxygen saturation. Decreased oxygen saturation indicates inadequate oxygenation, which is a crucial concern in clients with a suspected pulmonary embolism and requires immediate intervention to improve oxygenation and prevent hypoxemia. Question 34. A client with type 1 diabetes mellitus is prescribed insulin lispro. Which instruction should a nurse provide to the client regarding insulin administration? Administer the insulin 30 minutes before meals. Store the insulin at room temperature. rotate injection sites within the same anatomical area, administer the insulin subcutaneously in the deltoid muscle. Pause the video and select your answer. If you chose option C, you are correct. Rotate injection sites within the same anatomical area. Rotating injection sites within the same anatomical area helps prevent lipodystrophy and ensures consistent insulin absorption. Question 35. A client with chronic kidney disease is prescribed calcium carbonate. Which instruction should a nurse include in the client's teaching? Take the medication with meals. Avoid calcium rich foods while taking this medication. Increase your fluid intake while on this medication. Take the medication on an empty stomach. Pause the video and select your answer. If you chose option A, you are correct. Take the medication with meals. Taking calcium carbonate with meals helps enhance absorption and reduces the risk of gastrointestinal side effects. Question 36. A client with pneumonia is prescribed azithromycin. Which instruction should a nurse provide to the client? Take the medication with antacids. Complete the full course of the antibiotics. Skip doses if you start feeling better. Take the medication on an empty stomach. Pause the video and select your answer. If you chose option B, you are correct. Complete the full course of antibiotics. Completing the full course of antibiotics helps ensure eradication of the infection and reduces the risk of antibiotic resistance. Question 37. A client with COPD is prescribed ipratropium bromide inhaler. Which instruction should the nurse provide to the client? Use the inhaler as needed for acute shortness of breath. Take 2 puffs of the inhaler every 4 hours. Rinse your mouth with water after using the inhaler. Use the inhaler before using the albuterol inhaler. Pause the video and select your answer. If you chose option C, you are correct. Rinse your mouth with water after using the inhaler. Rinsing the mouth with water after using ipratropium bromide inhaler helps prevent dry mouth and throat, a common side effect of anticholinergic medications. Question 38. A client with hypertension is prescribed hydrochlorothiazide. Which instruction should a nurse provide to the client? Monitor your blood pressure every 3 days. Take the medication at bedtime. Increase your intake of potassium rich foods. Avoid prolonged sun exposure. Pause the video and select your answer. If you chose option D, you are correct. Avoid prolonged sun exposure. Hydrochlorothiazide is a thiazide diuretic that can increase sensitivity to the sunlight, leading to sunburn or rash. Clients should be instructed to avoid prolonged sun exposure and to use sunscreen while taking this medication. Question 39. A client with rheumatoid arthritis is prescribed methotrexate. Which instruction should a nurse include in the client's teaching? Take the medication with a meal. Avoid using folic acid supplements while on this medication. Drink plenty of fluids to prevent kidney stones. Stop taking the medication if you develop a cold. Pause the video and select your answer. If you chose option A, you are correct. Take the medication with a meal. Methotrexate can cause gastrointestinal upset, so taking it with a meal helps minimize gastrointestinal side effects. Question 40. A client is prescribed warfarin therapy. Which food should the nurse advise the client to consume in moderation due to its vitamin K content? Spinach, bananas, oranges, apples. Pause the video and select your answer. If you chose option A, you are correct. Spinach. Spinach is high in vitamin K, which can counteract the anticoagulant effects of warfarin. Clients on warfarin therapy should consume foods high in vitamin K, such as spinach, in moderation to maintain stable anticoagulation levels. Question 41. A client is prescribed prednisone for the treatment of asthma exacerbation. Which instruction should a nurse include in the client's teaching? Take the medication on an empty stomach. Increase your intake of potassium rich foods. Stop the medication if you develop a fever. Taper the medication dose gradually as directed. Pause the video and select your answer. If you chose option D, you are correct. Taper the medication dose gradually as directed. Prednisone is a corticosteroid medication that should be tapered gradually to prevent adrenal insufficiency and minimize withdrawal symptoms. Abrupt discontinuation of corticosteroids can lead to adrenal crisis. Question 42. A client with heart failure is prescribed spironolactone. Which laboratory value should the nurse monitor closely while the client is taking this medication? Serum potassium, serum sodium, blood urea nitrogen, serum creatinine. Pause the video and select your answer. If you chose option A, you are correct. Serum potassium. Spironolactone is a potassium-sparing diuretic that can cause hyperkalemia. Therefore, monitoring serum potassium levels closely is essential to detect and prevent hyperkalemia, which can lead to cardiac dysrhythmias and other complications. Question 43. A client with COPD is prescribed tiotropium bromide inhaler, which assessment finding indicates a therapeutic effect of the medication, increased respiratory rate, decreased wheezing, increased sputum production, increased oxygen saturation. Pause the video and select your answer. If you chose option B, you are correct. Decreased wheezing. Tiotropium bromide is an anticholinergic bronchodilator used to improve airflow in clients with COPD. Decreased wheezing indicates improved airway patency and reduced airway obstruction, which are therapeutic effects of the medication. Question 44. A client is admitted with a suspected myocardial infarction. Which medication should the nurse anticipate administering to dissolve the clot causing the MI? Streptokinase, enoxaparin, nitroglycerin, atropine. Pause the video and select your answer. If you chose option A, you are correct. Streptokinase. Streptokinase is a thrombolytic medication used to dissolve clots in acute myocardial infarction and other thrombotic conditions. It works by activating the conversion of plasminogen to plasmin, which breaks down fibrin clots. Question 45. A client with rheumatoid arthritis is prescribed methotrexate. Which laboratory test should a nurse monitor closely while the client is taking this medication? Liver function tests, serum potassium, blood glucose levels, serum sodium. Pause the video and select your answer. If you chose option A, you are correct. Liver function tests. Methotrexate can cause hepatotoxicity, so monitoring liver function tests is essential to detect liver damage early. Liver function tests include tests such as alanine aminotransferase, aspartate aminotransferase, and bilirubin levels. Question 46. A client is prescribed metoprolol for hypertension. Which assessment finding indicates a therapeutic effect of the medication? Increased blood pressure, bradycardia, tachycardia, hyperglycemia. Pause the video and select your answer. If you chose option B, you are correct. Bradycardia. Metoprolol is a beta blocker that reduces heart rate and blood pressure. Bradycardia indicates a therapeutic effect of metoprolol in lowering heart rate, which helps reduce cardiac workload and blood pressure. Question 47. A client is admitted with pneumonia and is prescribed ceftriaxone IV. Which assessment finding indicates a potential adverse effect of the medication? Decreased temperature, increased respiratory rate, improved oxygen saturation, yellowish discoloration of the skin. Pause the video and select your answer. If you chose option D, you are correct. Yellowish discoloration of the skin. Yellowish discoloration of the skin may indicate a potential adverse effect of ceftriaxone, such as jaundice or hyperbilirubinemia, which can occur due to liver toxicity or hemolysis. This finding should be promptly reported to the healthcare provider. Question 48. A client with heart failure is prescribed digoxin. Which assessment finding indicates a therapeutic effect of the medication? Decreased serum potassium level, increased heart rate, improved respiratory status, decreased pedal edema. Pause the video and select your answer. If you chose option D, you are correct. Decreased pedal edema. Digoxin improves cardiac output in heart failure by increasing myocardial contractility. Decreased pedal edema indicates improved cardiac function and reduced fluid retention, which are therapeutic effects of digoxin. Question 49. A client with deep vein thrombosis is prescribed enoxaparin. Which statement by the client indicates understanding of the nurse's instruction regarding the medication? I will administer the medication intramuscularly. I will massage the injection site after administration. I will use the medication to dissolve the blood clot. I will administer the medication subcutaneously in my abdomen. Pause the video and select your answer. If you chose option D, you are correct. I will administer the medication sub-Q in my abdomen. Enoxaparin is administered subcutaneously, typically in the abdomen, to prevent deep vein thrombosis or treat existing DVT. The client should be educated on proper injection technique and site rotation to prevent tissue damage. Way to go, guys. You made it to the end. Question 50. A client with hypertension is prescribed hydrochlorothiazide. Which instruction should a nurse include in the client's teaching? Take the medication in the evening. Monitor your blood pressure once a week. Increase your intake of foods high in potassium. Report any muscle weakness or cramping. Pause the video and select your answer. If you chose option D, you are correct. Report any muscle weakness or cramping. Hydrochlorothiazide can cause hypokalemia, which may manifest as muscle weakness or cramping. Clients should be instructed to report any signs or symptoms of electrolyte imbalance to their healthcare provider.